Question 1. In the context of radiation safety, Mr. Thompson is preparing a nuclear medicine procedure involving a radiopharmaceutical injection for a patient. He needs to determine the correct protocol for minimizing radiation exposure to himself, the patient, and others present in the room. Which of the following practices would be the most effective in ensuring radiation safety during this procedure? A. Standing as close as possible to the patient to ensure proper injection technique. B. Wearing only a lead apron to protect from radiation exposure. C. Minimizing exposure time and maintaining a safe distance from the patient during the procedure. D. Restricting the procedure to only one patient in the room at all times. Answer. Correct answer. C. Minimizing exposure time and maintaining a safe distance from the patient during the procedure. Explanation. According to radiation safety guidelines, the three primary principles for reducing radiation exposure are time, distance, and shielding. Minimizing the exposure time and maximizing the distance between the patient and technologist reduces radiation exposure. Wearing protective equipment, such as lead aprons, is important. But controlling exposure time and distance are more effective in reducing radiation levels. The ALARA, as low as reasonably achievable, principle emphasizes minimizing radiation exposure to all individuals involved. Question 2. Based on recent studies when handling radiopharmaceuticals, one key concern is the chemical properties that influence their stability and effectiveness. A certain radiopharmaceutical used in PET imaging exhibits rapid degradation when exposed to light. Which of the following is the most appropriate method for handling this radiopharmaceutical to maintain its efficacy? A. Store it at room temperature in clear, light-permeable vials. B. Keep it in opaque, light-protected containers until the time of administration. C. Refrigerate the radiopharmaceutical to prevent degradation. D. Store it in an open container to allow for proper air circulation. Answer. Correct answer. B. Keep it in opaque, light-protected containers until the time of administration. Explanation. Radiopharmaceuticals often require careful handling and storage to maintain their chemical integrity. Exposure to light can lead to degradation, which may reduce the efficacy of the radiopharmaceutical. Storing the substance in opaque, light-protected containers ensures it remains stable until administration. This practice adheres to the principles outlined in radiopharmaceutical handling protocols. Question 3. When analyzing the results of a brain imaging scan using SPECT, Mr. Lee notices that there appears to be an abnormal uptake in the temporal lobe. Given that the clinical indication for this scan was to evaluate Alzheimer's disease, which of the following would be the most appropriate next step for Mr. Lee to take in determining the clinical relevance of this finding? A. Immediately alert the radiologist to report the potential abnormality and advise the patient to undergo further neurological testing. B. Interpret the findings as a typical artifact of SPECT imaging and disregard them. C. Cross-check the patient's medical history and confirm the presence of temporal lobe atrophy before considering the abnormal uptake. D. Recommend immediate chemotherapy treatment for the patient based on the scan results. Answer. Correct answer. C. Cross-check the patient's medical history and confirm the presence of temporal lobe atrophy before considering the abnormal uptake. Explanation. When analyzing nuclear medicine images, especially in the case of suspected Alzheimer's disease, it is essential to correlate the imaging findings with the patient's clinical history. Temporal lobe involvement is a key feature in Alzheimer's disease, but imaging artifacts can also lead to findings. By cross-checking the patient's medical records, Mr. Lee can better determine if the abnormal uptake is clinically relevant or due to an imaging artifact. Question 4. During the process of preparing a radiopharmaceutical for administration, a nuclear medicine technologist notices that the radiopharmaceutical vial is cracked. Given the radiopharmaceutical's high radioactivity and the potential for leakage, which of the following actions should the technologist take immediately? A. Continue with the preparation as the vial is still safe to handle. B. Proceed with the administration but use a larger volume of the radiopharmaceutical to compensate for any leakage. C. Dispose of the cracked vial following proper radiation safety protocols and prepare a new intact vial. D. Inform the patient that the procedure will be delayed until further notice. Answer. Correct answer. C. Dispose of the cracked vial following proper radiation safety protocols and prepare a new intact vial. Explanation. When handling radiopharmaceuticals, the integrity of the container is paramount to ensure both safety and accurate dosing. A cracked vial poses a risk of contamination and exposure to radioactive material. According to radiation safety guidelines, the vial should be disposed of in a manner that minimizes exposure to radioactive material, following the established protocols for handling radioactive waste. A new intact vial should be prepared to ensure the patient receives the proper dose. Question 5. Considering the evidence surrounding radiation safety regulations, which of the following actions by a nuclear medicine technologist would best demonstrate adherence to the ALARA principle during a routine imaging procedure? A. Use the highest possible dose of radiopharmaceuticals to ensure clear imaging results. B. Limit the duration of exposure for both the patient and healthcare staff while ensuring accurate results. C. Skip irradiation shielding if the procedure will only take a few minutes. D. Always opt for the most complex imaging technique regardless of patient condition. Answer. Correct answer. B. Limit the duration of exposure for both the patient and healthcare staff while ensuring accurate results. Explanation. The ALARA, as low as reasonably achievable, principle is a core concept in radiation safety. It advocates minimizing radiation exposure to both the patient and healthcare staff without compromising the diagnostic quality of the procedure, limiting exposure time while maintaining the necessary dose for accurate results. Ensures compliance with this principle. Using the highest possible dose or skipping necessary safety measures such as shielding would violate ALARA guidelines. Question 6. Upon closer examination, a patient undergoing a thyroid scan with I-131 radiopharmaceutical presence with a thyroid mass, Mr. Martinez, the nuclear medicine technologist, is concerned about the potential risk of radiation exposure to the surrounding tissues during the procedure. Which of the following would be the most appropriate approach for minimizing this risk? A. Administer the maximum dose to ensure the thyroid mass is accurately imaged. B. Ensure proper patient positioning to minimize radiation exposure to nearby tissues while focusing the imaging on the thyroid. C. Discontinue the imaging procedure and refer the patient for a biopsy instead. D. Provide no additional precautions, as thyroid imaging typically involves minimal radiation exposure. Answer. Correct answer. B. Ensure proper patient positioning to minimize radiation exposure to nearby tissues while focusing the imaging on the thyroid. Explanation. Proper patient positioning is essential to ensuring that the radiopharmaceutical is concentrated in the area of interest, which in this case is the thyroid, while minimizing radiation exposure to surrounding tissues. The ALARA principle should be followed, which includes minimizing radiation exposure to both the patient and others present during the procedure. Administering a higher dose or discontinuing the imaging would not be the best approach in this scenario. Question 7. From a practical standpoint, during a routine quality control procedure for the gamma camera, a technician discovers that the uniformity test results are outside of acceptable limits. What is the most appropriate course of action for the technician to take in this scenario? A. Ignore the results and proceed with the imaging procedures as uniformity tests are not critical. B. Record the anomaly, but continue to use the camera until the next scheduled maintenance. C. Immediately take the camera out of service and report the findings to the responsible medical physicist for further investigation. D. Lower the quality control standards to align with the equipment's performance. Answer. Correct answer. C. Immediately take the camera out of service and report the findings to the responsible medical physicist for further investigation. Explanation. Uniformity tests are critical for ensuring the proper functioning of gamma cameras. If the results fall outside acceptable limits, it indicates a potential issue with the camera's performance, which could compromise image quality and patient safety. According to quality control protocols, the camera should be taken out of service immediately, and the issue should be reported to the medical physicist for further investigation and resolution. Question 8. Which of the following is the most accurate statement regarding the potential effects of improper radiopharmaceutical administration during a nuclear medicine procedure? A. The patient will experience immediate side effects, such as nausea or dizziness, within minutes of administration. B. The radiopharmaceutical will lose its efficacy within hours, requiring a complete redo of the procedure. C. There may be a delay in imaging results, but the radiopharmaceutical will not cause significant harm if administered incorrectly. D. Improper administration can result in inadequate imaging, increased radiation exposure, or inaccurate clinical results. Answer. Correct answer. D. Improper administration can result in inadequate imaging, increased radiation exposure, or inaccurate clinical results. Explanation. Improper administration of radiopharmaceuticals can lead to inadequate imaging results, misdiagnosis, or the necessity of repeating the procedure. This may also increase radiation exposure to the patient or healthcare staff. Correct preparation, dosage, and administration are critical for imaging and minimizing patient risk. Question 9. Given the circumstances when conducting a cardiac imaging study with a radiopharmaceutical agent, the technologist notices significant artifact patterns on the images. These artifacts are suspected to be due to patient movement during the procedure. What is the most effective approach for minimizing these artifacts in future studies? A. Increase the exposure time for each image to compensate for patient movement. B. Ensure that the patient is properly prepared and educated about staying still during the procedure. C. Ignore the artifacts as they do not significantly impact the overall clinical interpretation of the images. D. Apply a software algorithm that removes the artifacts without requiring changes to the imaging procedure. Answer. Correct answer. B. Ensure that the patient is properly prepared and educated about staying still during the procedure. Explanation. Patient movement during imaging is a common source of artifacts that can affect the quality of nuclear medicine images. Educating the patient about the importance of staying still during the procedure can significantly reduce these artifacts. If necessary, adjustments to the imaging technique or software can be made, but patient cooperation is a critical factor in ensuring high-quality images. Question 10. Taking into account recent advancements in nuclear medicine, a patient is scheduled for a PET scan to assess tumor metastases. The physician is concerned about the sensitivity of the imaging technique in detecting small lesions. Which of the following factors will most likely enhance the sensitivity of the PET scan in detecting these small lesions? A. Using a radiopharmaceutical with a shorter half-life to enhance signal detection. B. Increasing the administered dose of the radiopharmaceutical to improve image clarity. C. Employing advanced image reconstruction algorithms that improve resolution. D. Decreasing the time of the scan to minimize patient discomfort. Answer. Correct answer. C. Employing advanced image reconstruction algorithms that improve resolution. Explanation. The sensitivity of PET scans, particularly in detecting small lesions, can be enhanced by using advanced image reconstruction algorithms that improve resolution. These techniques, such as iterative reconstruction, allow for clearer imaging and better differentiation of small lesions, while increasing the dose or reducing scan time may have some impact. Improving the resolution through advanced algorithms directly improves the accuracy and sensitivity of the imaging procedure. Question 11. When considering the use of radiopharmaceuticals in bone scanning procedures, which of the following is the most critical factor for ensuring optimal image quality? A. The timing of administration relative to the imaging procedure. B. The patient's hydration status and fluid intake. C. The amount of radiation dose administered. D. The pharmacokinetic properties of the radiopharmaceutical. Answer. Correct answer. A. The timing of administration relative to the imaging procedure. Explanation. In bone scanning procedures, the timing of radiopharmaceutical administration is crucial to obtaining the best imaging results. After administration, the radiopharmaceutical should be allowed enough time to localize in the bone tissue before imaging. Timing affects the distribution of the agent, influencing image quality and diagnostic accuracy. Hydration status and fluid intake may impact radiopharmaceutical distribution, but as secondary factors. The radiation dose should be as low as possible, but not the primary determinant of image quality. Question 12. Considering the principles of radiation safety in nuclear medicine, what is the most effective method for minimizing exposure to both patients and healthcare workers during procedures? A. Minimizing the time spent near radioactive sources. B. Using lead shielding for all imaging equipment. C. Ensuring the use of high-energy radiopharmaceuticals. D. Increasing the distance between patients and healthcare workers. Answer. Correct answer. D. Increasing the distance between patients and healthcare workers. Explanation. According to the ALARA, as low as reasonably achievable principle, increasing the distance between the radioactive source, the patient, and healthcare workers is one of the most effective ways to minimize radiation exposure. Shielding and minimizing time spent near radioactive sources are also important but less effective when compared to maintaining a safe distance. High-energy radiopharmaceuticals are used for specific clinical purposes but do not inherently reduce exposure risk to workers. Question 13. Which of the following imaging techniques is primarily used to evaluate the heart's perfusion and function in nuclear medicine? A. Bone scanning. B. Cardiac imaging with SPECT. C. PET imaging for brain function. D. Thyroid imaging with technetium. Answer. Correct answer. B. Cardiac imaging with SPECT. Explanation. Cardiac imaging with SPECT, single photon emission computed tomography, is the most widely used technique in nuclear medicine to evaluate myocardial perfusion and function. It allows clinicians to assess areas of the heart muscle that are not receiving adequate blood flow. Bone scanning is used for skeletal imaging, while PET is typically used for brain and oncology imaging. Imaging is specific for thyroid conditions and uses agents like technetium. Question 14. To ensure the proper handling of radioactive materials in a nuclear medicine department, which of the following is most essential for maintaining safety? A. Strict enforcement of radiation shielding requirements. B. Accurate record-keeping of radiopharmaceutical dosages. C. Regular calibration of imaging equipment. D. Proper disposal of radioactive waste. Answer. Correct answer. D. Proper disposal of radioactive waste. Explanation. Proper disposal of radioactive waste is critical in maintaining a safe environment in a nuclear medicine department. It ensures that radioactive materials do not pose a risk to the environment or personnel after use. While radiation shielding, record-keeping, and equipment calibration are important for safe practice, waste disposal directly affects the overall set of the facility. Adhering to regulations for radioactive waste management is required by law and crucial for minimizing environmental contamination. Question 15. In response to a scenario where a patient is undergoing a PET scan with a radiopharmaceutical, what is the most important factor to consider for patient comfort and safety during the procedure? A. Ensuring the radiopharmaceutical is delivered as quickly as possible. B. The patient should be asked to avoid movement during imaging. C. Ensuring the patient is hydrated immediately before the scan. D. Administering a higher dose to improve imaging resolution. Answer. Correct answer. B. The patient should be asked to avoid movement during imaging. Explanation. During a PET scan, patient movement can severely degrade the quality of the images and the accuracy of the diagnostic results. The most important factor for patient comfort and safety is to minimize movement during the scan. Hydration and timing of the radiopharmaceutical administration are secondary, but still important for optimizing imaging. Increased dose could lead to unnecessary radiation exposure without improving image resolution. Question 16. During a radiation safety inspection, it was found that the radiation shielding for a nuclear medicine imaging room does not meet the required standards. What is the most appropriate course of action? A. Notify the nuclear medicine technologists immediately and proceed with normal operations. B. Cease all imaging activities in the room until the shielding is repaired to meet safety standards. C. Increase the exposure time per procedure to compensate for inadequate shielding. D. Continue operations with enhanced personal protective equipment for workers. Answer. Correct answer. B. Cease all imaging activities in the room until the shielding is repaired to meet safety standards. Explanation. In accordance with radiation protection regulations, any deficiency in radiation shielding must be addressed immediately to avoid unnecessary exposure. Ceasing operations ensures the safety of staff and patients until the shielding is repaired to meet the required standards. Increasing exposure time or using enhanced personal equipment does not address the root issue of insufficient shielding, and continuing operations would be a violation of safety protocols. Question 17. Considering the role of the nuclear medicine technologist, what is the primary responsibility of the technologist when administering radiopharmaceuticals to patients? A. Administering the radiopharmaceutical without requiring informed consent from the patient. B. Ensuring the proper identification and dosage of the radiopharmaceutical as per the prescribed protocol. C. Conducting the imaging procedure without following the specific protocols for radiopharmaceutical handling. D. Deciding on the radiopharmaceutical agent based on the technologist's personal experience. Answer. Correct answer. B. Ensuring the proper identification and dosage of the radiopharmaceutical as per the prescribed protocol. Explanation. The nuclear medicine technologist must verify the correct identification of the patient, the radiopharmaceutical, and the dosage before administration. This ensures patient safety and the accuracy of the imaging results. Informed consent is a requirement for all procedures but is the responsibility of the health provider rather than the technologist. The technologist must follow established protocols, and decisions regarding radiopharmaceutical choice should be guided by medical orders, not personal experience. Question 18. According to recent studies on imaging quality, what is the most effective approach to identifying and troubleshooting artifacts in nuclear medicine imaging? A. Immediately repeating the imaging study without analyzing the cause of the artifact. B. Examining the quality control parameters of the imaging system and reviewing patient positioning. C. Increasing the dose of the radiopharmaceutical to improve image quality. D. Switching to a different imaging modality without addressing the potential cause. Answer. Correct answer. B. Examining the quality control parameters of the imaging system and reviewing patient positioning. Explanation. The most effective approach to identifying and troubleshooting imaging artifacts is to first assess the imaging system's quality control parameters, e.g. calibration and maintenance, and ensure proper patient positioning. Artifacts can often arise from equipment malfunction or improper patient positioning. Increasing the dose or switching modalities may not address the root cause of the issue and could lead to unnecessary radiation exposure. Question 19. A patient presents with symptoms indicating potential thyroid dysfunction, and a nuclear medicine imaging study is ordered to assess thyroid activity. Which radiopharmaceutical is most commonly used for thyroid imaging? A. Technetium-99 meters per technetate. B. Iodine-131. C. Fluorodeoxyglucose FDG. D. Thallium-201. Answer. Correct answer. A. Technetium-99 meters per technetate. Explanation. Technetium-99 meters per technetate is commonly used in thyroid imaging because it is readily absorbed by the thyroid gland and provides high-quality images for assessing thyroid function. Iodine-131 is used for therapeutic purposes in thyroid disease but not for routine imaging. FDG is used in PET scans for oncology imaging, and Thallium-201 is used for cardiac imaging, not thyroid imaging. Question 20. In the context of infection control during nuclear medicine procedures, which of the following is the most appropriate practice when handling radiopharmaceuticals? A. Radiopharmaceuticals can be handled without gloves if they are in sealed containers. B. Disinfecting all surfaces and equipment only after the procedure is complete. C. Utilizing proper personal protective equipment (PPE), including gloves and gowns, during radiopharmaceutical preparation and administration. D. Administering radiopharmaceuticals without regard for infection control as the radiopharmaceutical is sterile. Answer. Correct answer. C. Utilizing proper personal protective equipment (PPE), including gloves and gowns, during radiopharmaceutical preparation and administration. Explanation. Proper infection control practices require the use of PPE, such as gloves and gowns, during the preparation and administration of radiopharmaceuticals to prevent contamination and ensure patient and healthcare worker safety. Radiopharmaceuticals may be but infection control protocols must still be followed to minimize the risk of contamination during handling. Question 21. During a routine calibration of nuclear medicine imaging equipment, it was discovered that the system's sensitivity is below the acceptable threshold. What should be the most immediate action to take? A. Notify the radiologist and proceed with imaging despite the issue. B. Conduct A detailed review of the calibration procedure and immediately recalibrate the equipment. C. Continue using the system for non-diagnostic procedures until the next scheduled calibration. D. Increase the radiopharmaceutical dose for future procedures to compensate for the lower sensitivity. Answer. Correct answer. B. Conduct a detailed review of the calibration procedure and immediately recalibrate the equipment. Explanation. When the sensitivity of imaging equipment falls below the acceptable threshold, the first step should be to recalibrate the system to restore optimal performance. Proper calibration ensures image quality and diagnostic accuracy. Simply notifying the radiologist or adjusting the radiopharmaceutical dose is not an appropriate solution as it does not address the underlying equipment issue. Question 22. Given the potential risk of radiation exposure to healthcare workers, what is the most effective method to reduce exposure when working in a nuclear medicine department? A. Increase the time spent near radioactive sources for better workflow efficiency. B. Ensure the use of protective lead aprons for all staff, regardless of role. C. Maximize the distance between staff and patients during procedures and use shielding whenever possible. D. Minimize the use of radiation protection protocols to enhance patient comfort and cooperation. Answer. Correct answer. C. Maximize the distance between staff and patients during procedures and use shielding whenever possible. Explanation. The most effective method to reduce radiation exposure is to maximize the distance between healthcare workers and radioactive sources. Additionally, using appropriate shielding helps protect staff from unnecessary exposure. While protective aprons are essential, focusing on distance and shielding provides a more significant reduction in exposure compared to other methods. Question 23. In light of recent developments in nuclear medicine, what is the primary advantage of using PET positron emission tomography over traditional SPECT single photon emission computed tomography for oncological imaging? A. PET provides better spatial resolution, allowing for more accurate localization of tumors. B. PET is less expensive and more widely available compared to SPECT. C. PET requires lower radiation doses for patients, making it a safer option. D. PET is more effective for imaging bone structures compared to SPECT. Answer. Correct answer. A. PET provides better spatial resolution, allowing for more accurate localization of tumors. Explanation. PET imaging offers superior spatial resolution compared to SPECT, making it ideal for detecting and localizing small tumors in oncology. PET scans provide high-resolution images, which help with the early detection of cancers. While PET has certain advantages in terms of sensitivity and image quality, it is typically more expensive than SPECT and may involve higher radiation doses depending on the radiopharmaceutical used. Question 24. A patient undergoing nuclear medicine imaging presents with a history of severe allergic reactions to iodine-based contrast agents. Which of the following would be the best course of action for the nuclear medicine technologist? A. Proceed with the imaging procedure using a standard iodine-based radiopharmaceutical. B. Choose a non-iodine-based radiopharmaceutical and inform the physician. C. Administer an increased dose of the radiopharmaceutical to ensure effectiveness. D. Postpone the procedure until the patient has undergone a complete allergy assessment. Answer. Correct answer. B. Choose a non-iodine-based radiopharmaceutical and inform the physician. Explanation. For a patient with a history of severe allergic reactions to iodine, the safest approach is to select a non-iodine-based radiopharmaceutical. This prevents potential allergic reactions while still allowing for effective imaging. The technologist must also inform the physician to ensure the clinical team is aware of the patient's history and can make appropriate adjustments to the treatment plan. Question 25. When preparing a patient for a thyroid scan, which of the following is the most important step in ensuring optimal imaging results? A. Administering the radiopharmaceutical immediately before the scan. B. Ensuring the patient has fasted for at least 12 hours before the procedure. C. Instructing the patient to limit movement during imaging. D. Increasing the dose of the radiopharmaceutical for enhanced resolution. Answer. Correct answer. C. Instructing the patient to limit movement during imaging. Explanation. Limiting patient movement during the scan is crucial for obtaining clear and accurate images. Any motion can lead to blurred or distorted images, reducing diagnostic accuracy. Although fasting may be necessary for certain scans, movement restriction is far more critical during imaging to ensure optimal results. Increasing the dose could increase radiation exposure unnecessarily. Question 26. Considering radiation protection regulations, which of the following would be the most effective method to manage radiation exposure for a pregnant healthcare worker working in a nuclear medicine department? A. Ensure the worker does not come in contact with any patients receiving radiation therapy. B. Allow the worker to continue working without any modifications as long as they wear protective equipment. C. Limit the worker's exposure by reducing their time spent near radioactive sources and providing additional shielding. D. Reassign the worker to administrative duties until after pregnancy. Answer. Correct answer. C. Limit the worker's exposure by reducing their time spent near radioactive sources and providing additional shielding. Explanation. The best approach to managing radiation exposure for pregnant healthcare worker is to reduce their exposure to radioactive sources by minimizing time spent near them and providing additional shielding. Radiation protection guidelines suggest that pregnant workers could continue to work in nuclear medicine. Appropriate precautions. Reassigning the worker or eliminating exposure entirely is unnecessary if proper safety measures are implemented. Question 27. A nuclear medicine technologist is preparing for a cardiac stress test using SPECT imaging. What is the primary radiopharmaceutical used for assessing myocardial perfusion in this type of procedure? A. Fluorodeoxyglucose FDG. B. Technetium-99 meters CertMedbry. C. Iodine-131. D. Thallium-201. Answer. Correct answer. B. Technetium-99 meters CertMedbry. Explanation. Technetium-99 meters CertMedbry is the primary radiopharmaceutical used for myocardial perfusion imaging in SPECT. It provides high-quality images of the heart's blood flow during stress test. Weleftergy is used in PET scans for metabolic imaging. Iodine-131 and Thallium-201 are used for other types of imaging such as that and cardiac imaging, but not in this specific protocol. Question 20. What is the primary consideration when selecting an imaging protocol for a patient with a known history of renal impairment undergoing nuclear medicine imaging? A. Choosing a radiopharmaceutical that has minimal renal excretion. B. Increasing the radiopharmaceutical dose to compensate for decreased renal function. C. Opting for a PET scan rather than a SPECT scan for improved imaging results. D. Selecting a radiopharmaceutical that is primarily excreted via the gastrointestinal system. Answer. Correct answer A. Choosing a radiopharmaceutical that has minimal renal excretion. Explanation. When selecting a radiopharmaceutical for a patient with renal impairment, it is important to choose one with minimal renal excretion to avoid further stressing the kidneys. This ensures safer administration and minimizes potential complications. While the dose should not be increased, the route of excretion is critical in such cases, and gastrointestinal excretion is preferred over renal excretion in these patients. Question 29. A patient undergoing a nuclear medicine procedure is receiving a high-dose radiopharmaceutical. In light of the ALARA principle, which of the following actions would be most appropriate to minimize the radiation dose to the patient? A. Increase the duration of the scan to obtain more detailed images. B. Use the lowest effective dose possible while still obtaining diagnostic quality images. C. Perform multiple scans to ensure that the radiation dose is spread out evenly. D. Administer the radiopharmaceutical intravenously to ensure rapid distribution. Answer. Correct answer. B. Use the lowest effective dose possible while still obtaining diagnostic quality images. Explanation. The ALARA principle, as low as reasonably achievable, dictates that radiation doses should be minimized while ensuring diagnostic quality images. Using the lowest effective dose possible helps minimize patient exposure to radiation while maintaining the accuracy of the diagnostic results. Increasing scan duration. Performing multiple scans may unnecessarily increase the radiation dose. Question 30. When evaluating nuclear medicine images for diagnostic purposes, what is the primary role of the nuclear medicine technologist in ensuring image quality? A. Adjusting the imaging equipment settings after the scan to improve image resolution. B. Ensuring that the radiopharmaceutical has been administered according to the prescribed protocol. C. Identifying any potential artifacts and determining their cause. D. Making clinical interpretations of the images for the physician. Answer. Correct answer. C. Identifying any potential artifacts and determining their cause. Explanation. The primary role of the nuclear medicine technologist is to ensure that images are of high quality and that any artifacts are identified and addressed. This includes troubleshooting issues such as patient movement or equipment malfunctions. The technologist does not make clinical interpretations of the images, which is the responsibility of the physician. Equipment settings or ensuring proper radiopharmaceutical administration are part of the preparation process but do not directly address image quality after the scan.